Hey everybody, again. So in the next few videos, we're going to talk about cardiovascular conditions. And just for the sake of expediency, I'm going to do one video on stroke, the causes and treatment of stroke, another on heart failure, and then I'm going to skip down to ischemic heart disease, which is the most common cause of myocardial infarction or heart attacks. So the pathology of stroke and ischemic heart disease are very, very similar. Obviously, brain and heart are two different organs, so the treatment is going to be different. We'll focus a bit more on heart failure because it's going to come back to a lot of the mechanisms that we talked about earlier on. So just to begin with stroke, some people refer to stroke as a brain attack or cerebrovascular. So just remembering that the pathology we're looking at is on the blood vessels that lead to the brain. Some of the stuff, third leading cause of death, we talked about that earlier. We talked about transient ischemic attacks or mini strokes a little bit earlier. And then also the influence that's going to have on diminishing brain blood flow, which is involved in dementia. So a healthy cardiovascular system will also equal a healthy brain. So here's actually the description of a stroke. A stroke occurs when the blood supply to the brain is interrupted or impaired. So you guys know the brain's very sensitive to a lack of oxygen, and so if that's impaired even for a very short period of time, you get impaired neurologic function and the brain cells start to die. If you remove whatever's occluding the blood vessel or restore flow, a lot of times brain is able to heal, but time is of the essence. So there's two main types of strokes. So the two main types of strokes, the hemorrhagic stroke, and you guys are familiar with that word, hemorrhage as in blood loss, and that's where a blood vessel bursts that leads to the brain. And then more common is an ischemic stroke. So that's what we're going to start with, is an ischemic stroke. Ischemia, again, means lack of blood flow, and in an ischemic stroke, as you can see on this picture, is anything that causes occlusion of a blood vessel that leads to the brain. So the ischemia is because of occlusion. Most often that occlusion is due to the formation of a blood clot. There can be transient occlusions where the blood vessels narrow because of atherosclerosis and then the blood vessel spasms closed. And again, that can cause a transient ischemic attack. But here in ischemic stroke, you either have a clot that forms at the site and occludes blood flow to the downstream areas. That's called a thrombotic stroke, which is one form of an ischemic stroke. And then there's an embolic stroke where you can have a clot that forms elsewhere in the body, sometimes in the legs, or dislodges, and then makes its way up to the brain. And then where that narrows enough, an embolic stroke, where that clot will lodge and occlude blood flow downstream. So ischemic stroke, where a blood clot impairs blood flow. In a hemorrhagic stroke, you have a blood vessel that becomes damaged and bursts. And that area where the blood vessel bursts, obviously it's going to start leaking out blood around the area. Neurologic brain tissue is very sensitive to the action. But obviously, you guys know the blood-brain barrier keeps blood itself from touching neural tissue. And so when you have a hemorrhagic stroke and the blood vessel bursts, that it has an irritating effect. Not only is the blood flow downstream lost completely, but the blood coming in contact with neuronal tissue causes the neurons themselves to become irritated and then eventually die. A secondary complication of hemorrhagic stroke is when that blood vessel bursts. As you guys know, the brain's encased tightly in our skull. You get an increase in pressure, and that increase in pressure because of the leaky blood vessel can occlude other blood vessels or cause the Cushing reflex, which is a normal response to increased pressure in response to a lack of blood flow. And so in a hemorrhagic stroke, if you have that increase in pressure, you're going to get an increase in breathing. So the two main types of strokes, an ischemic due to clotting or hemorrhagic due to blood vessels bursting in response to an increase in pressure. The symptoms of stroke are very, very diverse. They can have a rapid onset or a more slow onset, but you're going to see impaired neurologic function. That can be in terms of impaired neurologic function in terms of sensation. Inability to feel a part of your body, inability to think clearly. Oftentimes there's confusion, but then they can also have motor abnormalities as well, and that's where you can have difficulty moving, coordination problems, difficulty in speaking or recognizing speech, and then even something as dramatic as an impaired mobility. So lots of times those can be rather dramatic, or they can come on very gradual. In cerebral hemorrhage, where you have a hemorrhagic stroke, it's usually much more abrupt, as shown here. So the abrupt onset, usually you have fairly dramatic symptoms in a short period of time, and then in a progressive stroke, oftentimes you'll have small kind of graded diminishment in neurologic function. And sometimes when that sensation, it can be difficult to monitor very well. So progressive strokes, like we said, have that more gradual onset, often preceded by transient ischemic attacks. And so usually once someone starts having symptoms, diagnosis is made. Usually, obviously, the physician will do a physical neurologic exam, take history, and then what's shown here, which I think this is completely hokey because he has his mask up and his gloves off, but he's looking at some imaging here, either CT or MRI of the brain. And as you saw when we went back here on this hemorrhagic stroke, anytime you have asymmetry left to right, front to back, obviously this one's very, very dramatic with a very large bleed and the associated blood clot on the brain that could be associated with a brain bleed. So treatment of stroke is basically restore blood flow. If you can restore blood flow, then a lot of times the brain is able to heal. Like I mentioned, time is obviously quite important. If it's a blood clot that's formed, that blood clot inside an artery, the procedure is actually relatively straightforward. Thrombolysis, you could administer drugs that will reverse the formation of a clot. Streptokinase, urokinase, which we'll talk about a little bit later, oftentimes can dissolve the clot. Other times they can go intravascular and remove the clot. In a hemorrhagic stroke, that can be much more challenging. You have to stop the bleeding, and then once you stop the bleeding, if there's any residual blood on the brain, then that's going to have to be removed surgically, and you guys know that removes a very serious surgery. If clots are an issue, there's a series of medications, which we've mentioned a few of these before when we were talking about atherosclerosis, is clot prevention. Obviously, aspirin has the anti-inflammatory effects, which will stop the production of C-reactive protein, but then aspirin also has a weak inhibition of formation of clots. Same with heparin. Warfarin or Coumadin is much more robust. This is used more transiently, this is used chronically, and then if someone starts on Coumadin, that can oftentimes be a challenge to maintain that. But then again, what you're trying to do is just, the expression is thin the blood so that it doesn't clot. So that's the main treatments of stroke. We're going to see some of these similar types of treatment when we get to ischemic heart disease. But for right now, please remember the two main types of strokes, and then how each of those are treated. And once you understand that, I'm sure that you can come up, like we did with atherosclerosis, ways of preventing that disease.